One of those people who I'd been seeing for 30 years with coronary disease, relatively mild, hasn't had a heart attack. He actually said, with his LDL not optimized yet, on maximum
Mm-hmm.
dose of statin, exercising, but he hurt his knees, so he backed off the LDL, not where he wants to be. So I said, what is it that I could have said all these years to get you to do a whole food plant-based diet?
Okay.
And guess what he said? Oh, that would have been easy. All you had to do is make it full of beans. Really?
Aha.
Well, guess what I did? I went straight to my new buddy. This really was instigated by the JAMA article that maybe everybody saw about artificial intelligence.
Mm-hmm.
Background is that I had put it together all the data last September, given a grand rounds, saying essentially we all need to be using artificial intelligence, okay, to help us help patients. Don't tell anybody anything you haven't read in the last 18 months because it's probably wrong, particularly in cardiology. I mean,
Yes.
how many people saw the Panther trial and said, do not use aspirin as monotherapy if you have a P2Y12 available to you? I mean, but nobody's doing it. And so, as the data comes out, we need to change our practice. Well,
Mm-hmm.
AI will help us do that. So that trial that was published in JAMA said that I was wrong. Doctor versus
I agree with Dr. Kim and not with JAMA.
doctor for management versus AI versus doctor plus AI, and AI won.
Right.
AI is better without us.
Well, you see, I'm going to disagree with that because I use a lot of AI,
It's just data.
and I'll tell you that the reason that I disagree with that, and I sort of speak to a lot of doctors who are involved in AI and building AI models, and I'm building them obviously for holistic heart centers. So some of the things that I find is that there is this lack of trust in this new technology, and
Uh-huh.
so when you don't trust technology and you come in biased, you are coming in with a fixed mindset, not an open mindset. And so you're not learning, you're not iterating, you're not creating. And I think that's what honestly happened in the trial, that, the docs were sort of like, well, who needs AI? I'm better than that, So I think that was the reason.
But I think part of the problem is that not every physician, when you do a trial like that, it's about information and then the bias that made AI plus the doctor worse management than AI alone. Maybe we're hurting ourselves.